Okay, good morning. It's 11 o'clock, so we'll go ahead and get started. I want to welcome everybody today. Thank you for joining us. This briefing is being streamed live on our Rock County Public Health Department Facebook page. The recording after we're finished will be available on the Facebook page and also on our YouTube channel. We are going to be hearing some COVID-19 updates from our panelists first, and then we'll go to our media for any questions. I'm Jessica Turner, Public Health Communications Specialist for the Rock County Public Health Department. And joining me today, I have Katrina Harwood, the new health officer for the Rock County Public Health Department, Kelsey Cordova, Public Health Specialist, and Nick Zupan, Epidemiologist. So first, we're going to go to Katrina for some general COVID-19 updates.
Thank you so much, Jessica. As Jessica said, my name is Katrina Harwood. I am the new health officer here in Rock County. I just started on Monday, so I'm getting up to speed on all of the activity of the team and the community. So very excited to be here in Rock County. As far as some general updates for our response, ensuring access to COVID testing is an essential component of our response. And we are very excited to announce that the Wisconsin National Guard is able to continue to support our testing site at Black Hawk Technical College until at least May 27th. And a special thank you to Black Hawk Tech for hosting that site. Testing at the site will continue to be provided on Wednesdays and Thursdays from noon to 5. Also, the Wisconsin Department of Health Services has announced that individuals with general COVID-19 vaccine questions can now call a statewide number, which is 844-684-1064. Again, that phone number for anyone who has general COVID vaccine questions is 844-684-1064. The call center is also available to assist individuals with finding vaccine locations, answering medical questions related to the vaccine, and registering for an appointment. This also includes questions about employment, travel, eligibility, adverse reactions, safety, and where to get vaccinated. So it has a lot of information right in that phone number. Right now, we are seeing a drop in the number of people testing positive and the number of people who are hospitalized. This drop isn't due to any one thing, but rather a combination of preventative measures and vaccination. If we remain focused, despite the very understandable COVID fatigue that is happening in our community, it will pay off in the future. Right now is the time to continue the safety precautions and not back down. Please continue to wear a mask, social distance, stay home if you're sick, and get a vaccine if it's available to you. The more we do now, the more successful we will be, and the more we will be able to return to our normal activities. As long as the data continues to demonstrate that we have less community spread of COVID-19, we will be looking to relax some of the restrictions that are in place. Vaccines are a great strategy. They will not result in COVID-0, but they are on track to reduce both infection rate and serious disease, and therefore reducing hospitalizations and deaths. There is an end in sight, and by working together, we can get there quicker. So thank you all for joining today, and I'll pass it back to Jessica.
Thank you, Katrina. I'm going to now hand it over to Nick for some data updates.
Thanks, Jessica. Just want to go over some of the specific numbers that we're seeing in terms of our case activity and hospitalizations and those kinds of things. So as of yesterday afternoon, we have had 14,517 Rock County residents test positive for COVID-19. Based on the numbers that we're seeing on a daily basis, we're averaging about 12 new cases per day over the last week. So our case activity continues to drop. The numbers are looking good right now, and as Katrina mentioned, we're just asking everyone to remain vigilant so we continue to see those numbers decrease. Right now, we're seeing about 167 active cases out in the community. There have been 162 deaths among Rock County residents due to COVID-19, and this is an increase of 3 since last week. Our hospitalization numbers remain low. We had 4 patients in the hospital getting care for COVID-19. So this number continues to decline. We're averaging about 5 patients in the hospital on any given day getting care for COVID-19 over the last couple of weeks. So again, numbers are looking good in terms of those who have severe illness. And then switching gears and looking at our vaccination numbers, we're seeing steady increases in those who are getting vaccinated. So as of this morning, we have about 32,000 Rock County residents who have gotten the first dose of either the Pfizer or Moderna vaccine, which is about 20% of our total population, which is great. We continue to see that number increase, and I hope to see that number steadily increase and increase at a faster and faster rate as the vaccine supply increases. We've had, let's see, about 20,000 individuals in Rock County complete their vaccine series. So that's either having 2 doses of the Pfizer or Moderna vaccine or getting 1 dose of the new Johnson & Johnson vaccine that is now available. In terms of our 65 and older population, we've had almost 19,000 65 and older adults get at least the first dose of the vaccine. So that's about 67% of the 65 plus population in Rock County. And just over 10,000 individuals who are 65 and older have completed that vaccine series. So that's about 37%. So we're on track with that population who's 65 and older, who's at greater risk of severe illness. We really want to make sure that we're protecting that population specifically. So good trends, and we hope to see those continue. The one thing that I did want to mention on this call today is that on March 4th, the Wisconsin Department of Health Services identified a new variant strain of COVID-19 in Wisconsin. This strain is known as B1351. So this is the first case of this strain that has been identified in Wisconsin. It has been identified elsewhere in the world. This was the first case identified in Wisconsin. As of today, there have been 26 cases of another variant called B117, and this the 1 case of the B1351. I know the names are not super exciting, but these variants have been identified in Wisconsin, thankfully not in Rock County, but these variants do give us some cause for concern. There is evidence that both of these variant strains of the virus are more easily and rapidly spread in populations. And it's not yet known right now in terms of the B1351 strain if it causes more severe illness. So that's why we're asking all of our Rock County residents to remain vigilant in protecting themselves and preventing the spread of the virus. And again, just to reiterate, this means wearing a mask when you go in public, physically distancing from others, getting tested if you feel like you have symptoms or you need a test, and also getting vaccinated when you're eligible. All of these practices will help us continue to fight the virus and also prevent the spread of these new emerging strains in our community. So with that, I'm going to turn it back over to Jessica.
Thank you, Nick. Now, Kelsey will give some additional information about the vaccine eligibility and how to request a vaccine.
Thanks, Jessica. So first, I'd like to remind everyone who is currently eligible for the COVID-19 vaccine in Wisconsin. Healthcare personnel, residents of long-term care facilities, individuals aged 65 and over, police, fire, and correctional officers, educators and child care workers, people enrolled in Medicaid long-term care programs, some public-facing essential workers like transit drivers, food service workers, and 911 operators, non-frontline essential healthcare personnel, and residents and staff in congregate living settings. Even though we have a new vaccine available and allocations will begin to increase, we still have a limited supply of vaccine. There are still some prioritizations within these groups that I mentioned above, but if you fall into any of these groups I listed, you are currently eligible to request and receive the COVID-19 vaccine. If you have questions about whether or not you are included in the eligible groups, please see the Wisconsin Department of Health Services website at dhs.wisconsin.gov or call 844-684-1064. Remember, it will take some time for us to get through all of these eligible groups. For those that are eligible, there are a number of ways to request a COVID-19 vaccine. You can look for information on MyChart or your healthcare provider's website for information. And once you submit a request, you'll be on the list for that health system and will be contacted when they have appointments available. You can also fill out a request form on the Rock County Public Health Department website or call 608-352-6727 for assistance. Once your request is received, your information is shared with multiple Rock County vaccine providers, and you'll be contacted when one of them has available appointments. Additionally, you can fill out the request form for the Wisconsin COVID-19 Vaccine Registry at dhs.wi.gov or call the state hotline at 844-684-1064, and you'll be placed on a waiting list and contacted when there are available appointments with local participating providers. At this time, the only provider that is participating in the system are the DHS community vaccination sites at Black Hawk Technical College in Rock County. And you can call or check the websites of local pharmacies for instructions on how to register for a vaccine. Once you have submitted a request form through a local pharmacy, you'll be on their list and will be contacted when they have appointments available. So due to the limited amount of vaccine and the vaccine allocation process, most vaccine providers are only able to schedule appointments 1 or 2 weeks at a time. The amount of available appointments will change based on the amount of vaccine that they receive. So when you sign up on one of these lists, you may not be contacted right away to schedule your appointment. We know that this can be frustrating, but we're all doing the best we can with the limitations that we do have with the vaccine distribution. To the best of our knowledge, the only wait list for those who are not currently eligible is through the Wisconsin COVID-19 Vaccine Registry. It's important to note that if you're not currently eligible to receive the vaccine, being on a wait list will not give you access to any extra doses of the vaccine. As we know, the vaccines have complex storage requirements. So all doses taken out of storage need to be used. It cannot be put back into storage. Even though careful planning is in place to only remove doses needed for a particular day for a particular clinic, there could be several remaining doses at the end of the day. We have plenty of eligible people who would like the vaccine. So vaccine providers have processes in place to contact those eligible people to receive the extra doses in order to avoid wasting vaccine. So I'll turn it back over to you, Jessica.
Thank you, Kelsey. So now we'll open it up to questions from the media. We ask that you raise your hand and we will allow you to unmute and ask your question. For those who are joining us via phone, just a reminder, *9 will raise your hand and *6 will control the mute function. Let me take a look and see. It looks like, let's go first to Austin Montgomery from Beloit Daily News.
Thanks for taking my call, guys. Just wanted to ask, what are the current levels of the vaccine shipments currently being received by the county? Thanks.
Hi, Austin. Not sure we can give you an exact number today. The Rock County providers across the county receive varying number of doses each week based on the requests that they submit to the state. So we do not have a total for you, but it is something that we can look into and get back to you on.
Thanks, Austin. Next, we'll go to Ashley McCallum with the Janesville Gazette.
Hi, everyone. I was looking at the vaccine dashboard this morning, and I see that some Johnson & Johnson vaccine has been administered in Rock County. Could you tell us where that vaccine is being administered and if the county has given any specific instructions for who should get that vaccine, if there's prioritization for that to go to certain eligibility groups or not?
Thanks, Ashley. Sorry, Nick, feel free to jump in. So we do not have the information on which vaccine providers have the Johnson & Johnson vaccine. All 3 currently authorized vaccines are randomly distributed based off of a formula that the state uses to allocate those vaccines. So we do not have any additional information about where those might be being used.
Great, thank you, Ashley. We'll go back to Austin from Beloit Daily News. Go ahead, Austin.
Thanks. Yeah, I know that on everyone's mind is about reopening right now. We're seeing some places across the country reopen faster than others. I'm not sure who could address this from the health department, but just wondering kind of what the next metrics are that are going to be monitored the most for determining whether or not some next steps for loosening restrictions can be made.
Yeah, I can answer that question. In terms of the metrics that we're evaluating, these are all found on our Rock County reopening dashboard. And it's a variety of metrics in terms of case activity, our hospital system, strain and staffing and resource levels. We kind of use all of those metrics in tandem and to inform the process. We also use input from our community partners to make sure that we are kind of making decisions in accordance with how people are, how the health systems are doing and how they're feeling, not just based on the data alone. I can say that the metrics are looking very positive right now, and the hope is always to get back to as normal as possible while preventing the spread of the disease and making sure we continue to see kind of very low levels of case activity. So we continue to monitor those trends on a weekly basis. And, we're in ongoing discussions about the metrics and with our partners about kind of the next phase of reopening. It probably won't happen like immediately, but I think it's, one of the things that's on the forefront of our minds right now.
Thanks, Nick. And I'll just add also that we did recently open up to phase 2 of our reopening plan. And we do want to pause for several weeks so that we can evaluate the effects of loosening those restrictions before we consider loosening them any further. So we'll go to our next question, and we'll go to Ashley from the Janesville Gazette. Go ahead, Ashley.
Yeah, so we've talked before on previous calls that we host each week about disparities in getting vaccine to people who are in different race and ethnic groups. Some strategies had been mentioned before for getting vaccine to people of color and people of different ethnicity, but the number of vaccine doses based on what the dashboard is saying to people of color have remained pretty stagnant, and the race gap is widening. So I wanted to ask, do you think these strategies that have been considered, do you think they're ineffective? Are you looking at changing anything to try to improve on this? I guess, what are those conversations like right now?
Kelsey, if you want to go ahead, otherwise I can take it.
Yeah, well, I'll just be brief, and Jessica, if you have anything to add, I welcome it. I think that one thing to consider is our current eligible groups. I think that they're the eligibility sort of groups that have been rolled out over the course of vaccine availability has sort of allowed a difference in vaccination rates. We do have our vaccine advisory committee that continues to dive deeper into the equitable vaccine distribution and allocation. And we continue to try new mechanisms and welcome new input from communities of color and those who are, not being served as frequently as others in the community for vaccine distribution. Jessica, anything you'd like to add?
I was just going to add that keeping in mind the limited amount of vaccine and the amount it takes from the time that somebody registers for a vaccine to the time that they're actually able to schedule an appointment, maybe several weeks. So any outreach efforts and things of those sort may take a little while to show up in the data. Okay, do we have any other questions? Like Ashley has another question. Go ahead, Ashley.
Yeah, the state is expected to announce today the next phase of eligibility, which is expected to include people with pre-existing health conditions. I was wondering if the health department is doing anything to prepare for this announcement, and if so, if you're a person with a pre-existing condition that puts you at heightened risk for COVID-19, is there anything that those folks should be doing right now to prepare so that they're ready to go once eligible? I know we don't know what date that will be quite yet, but if you're in that group, what do you think those folks should be thinking about or doing to prepare?
Sure. So we are waiting on DHS recommendations for future eligibility groups as eagerly as the rest. So hopefully we'll know more this afternoon as well. In terms of what those groups might consider now, like we mentioned, those who aren't currently eligible for the vaccine can join the Wisconsin COVID-19 vaccine registry at vaccinate.wi.gov. And that will sort of help funnel them into the priority group based off of their eligibility, even as future eligibility groups are rolled out. I think that's all I have to mention, unless I'm forgetting something.
I'll just jump in and say that, as we find out who is eligible based on this announcement, we'll probably come up with a similar process that we have for the other eligible groups on our Rock County website for people who are eligible to share their information via an online survey, and then we'll pass that along to local vaccine providers. So hopefully we'll have multiple ways of people getting connected to vaccine providers, both locally and at the state.
Great, thank you. And thank you for the question, Ashley. Do we have any other questions from our media? Okay, not seeing any more questions. I think we can conclude this media briefing for today. Just a reminder that these media briefings take place every Thursday at 11 a.m. They are live streamed on our Facebook page, and the recordings are made available on our Facebook page and YouTube channel once the briefing has concluded. So I want to thank everybody for their participation and thank everyone who's been watching us via Facebook Live. If you're a member of the media and you'd like to participate in future media briefings, please send an email to media.publichealth@co.rock.wi.us and we will provide you with the information to participate. Be safe and be healthy, everyone.